Good afternoon, everyone, and thank you for joining us today. I'm Dr. Adam Gonzalez, and I use he, him pronouns. I'm a clinical psychologist and the division chief of behavioral health. I'm also the co-chair of our Stony Brook Medicine LGBTQ committee, and I'm also a gay man. We're here today during Transgender Awareness Week as we honor Transgender Day of Remembrance, which is actually this Sunday, November 20th. Trans Day Remembrance is an internationally recognized day to memorialize all of the individuals who have lost their lives to violence due to hate and transphobia. According to the Human Rights Campaign, last year, 57 transgender or gender diverse people were fatally shot or killed by other violent means here in the US. Other stats indicate that 375 trans individuals were killed globally last year. The goal for today's panel is to help increase awareness and knowledge about gender identity and expression, what it means to be transgender, and what the lived experience is like for trans individuals, as well as their families. We will also discuss what Stony Brook Medicine is doing to care for the trans community. And during this live broadcast, please feel free to ask questions by scanning the QR code on the screen, and we'll do our best to answer the questions throughout the broadcast. So please be sure to ask them, and we'll do our best to answer them. We have an amazing panel today, and I'm going to have them introduce themselves now. So let's first start with Dr. Allison Eliscu.
Hi, everyone. Good morning. My name is Dr. Allison Eliscu. I'm the Chief of Adolescent Medicine here at Stony Brook Children's, and I'm also one of the co-chairs of the LGBTQ committee along with Adam, and I'm also the director of the Adolescent LGBTQ program here at Stony Brook Children's. And my pronouns are she and her.
Thanks, Allie. Well, next, let's turn to Dr. Wilfred Farquharson.
Good morning, everyone. My name is Dr. Wilfred Farquharson. I'm a licensed psychologist with the Department of Psychiatry and Behavioral Health. I'm also the Director of Ambulatory Behavioral Health for the Child Division. I go by he, him pronouns, and I'm excited to be here and hopefully share some information about some of the mental health supports that are available here at Stony Brook.
And Mary.
Good afternoon. My name is Mary Paciella. I'm the Director of Employee Health and Wellness here at Stony Brook Hospital. My pronouns are she and her, and I'm here to tell you a little bit about the experience of having a transgender child.
Great. Thank you all. So we're really excited to get started, and to get us started, I'm going to share a slide here that breaks down some of the basic terms so that we can all be on the same page when talking about gender identity, gender expression, as well as birth sex or sex assigned at birth, and also sexual orientation and what these different terms mean. I know it can get confusing, and oftentimes we may just hear the term LGBTQ, and all these groups are combined into one. So let's break that down now. So this gender bear is a really nice way to simplify and break down the different terms. As you'll see on the right-hand side, a list of the main terminologies, and you'll notice here that they all fall along the lines of a spectrum. So if we start with gender identity, this is how one sees themselves and how one feels. And this could range from woman to man. And there in the middle there's also gender queer, there may be non-binary, and other terms that people might choose to identify as that might be more neutral in nature. If you go down to the middle, you'll see the heart, and this is sexual orientation. So who we are attracted to sexually and emotionally. And again, there's a range here. And then at the bottom, you have the X or the chromosomes. And this is the sex assigned at birth based on our genitalia, reproductive organs. And again, here we may have female, intersex, and then also male. On the outside, we have gender expression. And so this is how individuals choose to express their gender identity. And again, we can have a range from feminine to masculine, And people can choose to express their gender identity in many different ways. We typically will think about stereotypical ways of expressing being more masculine or feminine, like, for example, the haircut someone chooses or wearing makeup, the pronoun someone chooses. And we'll talk more about pronouns a little bit later as well. A couple of things really important to point out, that because gender expression doesn't necessarily equal gender identity. So because somebody presents in a more masculine way, we don't want to assume that that person identifies as male or a man. Similarly, sex does not equal gender identity. So we're assigned a sex at birth, but that doesn't necessarily mean that how we identify gender is going to be the same as what's stereotypically associated with that sex assigned at birth. So I often like to correct people when they say that they're having a gender reveal party. You're actually having a sex reveal party based on reproductive organs that are being observed. So those are our basic terms. Panelists, anything you'd like to add on those terminologies? Anything to expand on?
Thank you for showing that, Adam. I think sometimes people get a little confused about the different terms and how they all fit together. So I appreciate you sharing that.
Right. And even in terms of like the LGBTQ and some of those terms, folks may have noticed when we first started our first slide, there's a little asterisk after LGBTQ. And the reason why we show that, you'll see on the bottom there, is that we support all sexual orientations and gender identities. So people might choose to identify in many different ways, and we want to respect that. So I'm going to turn it over now to Dr. Allison Eliscu to review some hot off the press results from our Stony Brook Medicine LGBTQ Health Needs Assessment. So this was a large, first of its kind survey with over 30 community-based collaborators. We're really excited to have the results of this survey to understand the health needs of sexual and gender diverse adults here in Long Island. So I'll turn it over now to Dr. Allison Eliscu.
Thank you, Adam. Yeah, I'm really excited to show these slides and talk a little bit about some of the results of our survey that was done last year. Like Adam mentioned, this was the first of its kind community health needs assessment survey of Long Island's LGBTQ community. And so this was a survey of adults, people 18 and older, who were living or going to school in Nassau or Suffolk County. It was out from June through September 2021. And as Adam mentioned, we collaborated with over 30 partners throughout the community, really tried to get this survey out to understand a little bit more about the needs of our community, where people may be struggling, some positive or negative experiences people have had in the community or in healthcare. And we really wanted to understand what we can do better with our community. As Stony Brook Medicine and as the community partners, we really wanted to hear the voice of our community and make changes. Our goal was to have at least 1,000 surveys, and you'll see towards the bottom of that slide, there were 1,150 completed surveys. So we're thrilled that the community did come out and answer this survey. On the next slide, I'm going to show you a little bit about who answered this survey. So this is just some of the brief demographics. You can see based on age that we did have a little bit of a younger community, potentially because it was an online survey. But we did have some people as old as in their 80s respond to the survey as well. And you can see some of the breakdown of our demographics. The majority were Caucasian, 20% identified as Hispanic, and just over half identified as mid or high income. And we asked individuals if they identified as transgender, and just under 15% of the survey identified as transgender. On the next slide, you'll see how we asked about sexual orientation. So you'll see here that this was actually a free text response, which gave suggestions as people started typing. So people were able to enter any information here, any way that they identified for their sexual orientation. And that was very important. That was information that came out of the focus groups with the community members, with LGBTQ individuals, and with our community partners. that people feel that they should be able to identify however they feel that they fit in or identify. So you may see here some identities listed here on the left side that may not typically be considered identities we may think of as typical sexual orientation identities, yet that is how individuals responded. And we felt it was really important that people were able to find themselves in this survey and identify how they truly feel. You'll notice on the right of that slide that for statistical purposes, we combined all of these terms so that there are 6 sexual orientations that we statistically analyzed in the data. And the bottom one, that blue one, and there were categories that less than 50 people had responded, they were grouped into this category called identities less than 50. On the next slide, you'll see similar results for the gender identity. So here also was a free text response. People could add any gender identity that they identified as. You'll see multiple different responses. Again, you'll see some responses that we don't typically think of as a typical gender identity response. But this is how people responded to the question. And then on the right, you'll see that for statistical purposes, we combined them into 3 different categories: those identifying as female, those identifying as male, and with any categories that had less than 50 people responded, we grouped them into gender nonconforming. So on the next slide, we'll start taking a look at just some of these results. And it's a little disturbing to see when we look overall at mental health difficulties, this is a community that is really struggling. Keep in mind that this was run last year in 2021, which was during COVID, and that may have altered some of these responses. But overall, you see that almost half of the people who responded felt that their mental health was fair or poor. And over a third of people felt that they had moderate to severe anxiety or depression symptoms. That middle bar for chronic depression, that means having symptoms of sadness or depression lasting at least 2 years on most days. So that's remarkably high that nearly 2/3 of the population responded in that way. And almost a quarter on that right side, you'll see almost a quarter had serious thoughts of wanting to kill themselves within the last 3 years. On the next slide, we break it down a little bit because even though these numbers are staggeringly high, it's actually not universal across the entire group. So for example, when we look at moderate to severe anxiety or depression, you'll see on the right, that red bar, overall 38% of our population is struggling with this. Yet when we look at some of these subcategories, some of these subgroups, you'll notice that those who identify as gender nonconforming, those who identify as transgender, those who identify as pansexual or queer, those individuals have rates of moderate to severe anxiety or depression much higher than the overall survey result. When you look on the next slide, you'll see pretty similar when we look at symptoms of chronic depression. Again, very similar trends. So when we're looking at these results, yes, we're looking at them overall, but we're also looking at some of the subpopulations and seeing what specific groups are struggling more than others, and really trying to make changes to address these issues. On the next slide, you'll see some positives. So when we look at those who were in mental health treatment at the time of the survey, that's either therapy or taking medication for mental health or both, you'll see that red bar on the right. Overall, over a third of people were in mental health treatment. And the positive is that some of the groups that were really struggling, those who were transgender, those who identify as nonconforming, those who are pansexual or queer, you'll notice that they have higher rates of using mental health treatment compared to the overall population. Though I would say probably not nearly as high as where we really should be with this. On the next slide, we look at barriers to care. And perhaps not surprisingly, in Nassau or Suffolk County, travel time, cost, transportation can be barriers to care. But when we look at what's potentially the highest barrier to care that we found, was that over a third of individuals have had a negative experience in healthcare so far. And when we ask those groups, how has that affected or has that changed how you get healthcare? Nearly 70% said that made them less likely to seek medical care or affected the way that they get healthcare. But on the next slide, you'll see when we take that specific question, those individuals who may have struggled or had a negative experience in healthcare, that may be with the provider, with a nurse, with someone at the front desk, any staff member in a healthcare setting. Overall, like I mentioned on the right, you see that red bar, and over a third, 37%, have struggled with this. But again, you'll see pretty similar subpopulations that have higher rates. So half, or 50%, of those who identify as gender nonconforming, 60% of people who identify as transgender, over half, 52% of those who identify as queer, have higher rates of having negative experiences. And we know that that's impacting how people are using healthcare and their comfort level in a hospital or in a doctor's office. On the next slide, we see some of the preventive care. So when you look at the circles all the way on the left and the middle one, those are rates of breast cancer screening or cervical cancer screening for individuals where they should appropriately be screening. And you can see that for breast cancer, only 71% had gotten their breast cancer screening appropriately, which sounds like it may be pretty positive, but the goal really should be at least 80%, if not more. That's based on the National Healthy People 2030 goals. When we look at cervical cancer screening in that middle circle, only 65% had that test done. And we know for gender diverse individuals, getting these screenings done, breast cancer or cervical cancer screenings, can be really challenging. Maybe parts of their body people aren't very comfortable with, can be a difficult or very sensitive exam to do. And sometimes people aren't comfortable even going to a provider to get these services done. But we do need to keep in mind that cancer doesn't discriminate based on someone's sexual orientation or someone's gender identity. So these are really important screens that people should be having done. Even on the right, looking at who has a regular healthcare provider, we see that 75% have a regular primary care doctor, which sounds pretty good, but that means that a quarter of the people who responded to the survey do not have a primary care doctor. And that's something we really need to improve on. On the next slide, we look at those who have experienced verbal harassment based on gender or sexual identity. Unfortunately, you see across the bar, pretty much almost everybody has had pretty high rates. Almost all these groups have had extremely high rates of experiencing verbal harassment. So these are definitely issues. This is a population that is struggling, and we need to be doing a better job to try to make sure resources are there and we're reaching out and helping to address this. On the next slide, I just wanted to highlight one last thing. We asked individuals who responded to the survey what's important to the LGBTQ community overall in Nassau and Suffolk counties. And you'll see they responded very favorably that many of these issues are extremely important to the community. You'll notice right up there at number one, 96% was behavioral health. The second one was training providers about LGBTQ health. And we'll talk a little bit further along about that we're hearing these things. We're hearing these requests and we're hearing how important these issues are. And we are making changes at Stony Brook Medicine, and also as the community partners are addressing this as well, to try to make sure that we're addressing these issues that are important to the community. So that's just a kind of a brief overview of the survey results. There is a microsite that is available that goes through the results even in more detail that we'll put up on the screen in a moment. But I also wanted to just turn this over to go through a pretty cool video that we've seen on the importance of pronouns. Adam Gonzalez mentioned using pronouns and how important pronouns can be. And we just wanted to highlight this video for a moment to show you.
I go by she, her, and hers pronouns. That's just how it's been for me.
My pronoun is he, and I present as a he. Some trans people might look like me and present as a she.
Recently, I've come across they, and I like they. So you can refer to me either as she or they.
I like to be referred to as many things. It's really about what sort of feels good to our ears when we hear it.
Pronouns are important because they indicate a degree of respect. Who doesn't want to be respected?
For a long time, a lot of people have felt like that they don't fit into the mold of primarily he or primarily she, or maybe they feel they're a blend of both and that there's not really a word for that.
I found out about gender nonspecific pronouns Z and here, and I thought that was funny. That makes people trip up, because really technically I'm not a she. I'm not a he either.
There are some situations where we really put way too much stock into whether or not somebody is a man or a woman. There's a lot of situations that we just don't need to necessarily have gendered language. If you're unsure about somebody's pronoun, pull them aside and ask, hey, what are your pronouns?
It's not even preferred pronoun because it is their pronoun.
So some people go by he, some people go by she, some people actually use the pronoun they.
You can avoid mistakes by just saying them, theirs, they.
Their gender is still valid regardless of whether or not you understand it.
Misgendering a person by using an incorrect pronoun is an act of disrespect.
Everybody else in the world out there can say, I am, and they identify themselves, and everybody believes them. But when I say I am, I don't know why people just don't believe us.
So I wanted to just turn this back to the panel a little bit to reflect on the video.
I know I've seen this video a lot, and for me, it's a really touching video because it highlights individuals' lived experiences with using pronouns and how important it is. That the last person who spoke, that one always gets me of like, I'm telling you who I am, why don't you believe me? And even if we don't get it, even if somebody doesn't understand fully or get gender identity, why can't individuals be respected?
Yeah, I think obviously I would echo your sentiments there, Adam. And additionally, I wanted to share my reflection on the results of the survey. So first off, Allison, to you and the folks that you work with, thanks so much for highlighting all of the needs of this community. It's pretty concerning that people have had negative experiences in the medical field, and we have a lot of medical mistrust for a variety of issues. And I think to see that and to see the correlation between people that have not sought out treatment, and you'll also see the disparity in terms of folks that are endorsing symptoms and symptoms that are quite risky for us in the mental health professionals, to then see that those people are not coming to care. So I think we have a lot of work to do in our industry, and I hope our mental health contingents are paying attention so that we can work to eradicate some of the inequity that we're seeing.
And agreed. In fact, that pronoun video is so profound. And actually, Dr. Eliscu and I were speaking about this the other day, but the lack of respect or lack of understanding or acceptance that patients feel, I can remember a couple of times, and no one is being malicious. Some people may not want to use the proper pronouns, but by misgendering or using the wrong pronouns, that can shut down all forms of conversation from the very beginning, and then lead to people not trusting their healthcare providers later, or the individual that may be helping them in some way or having some relationship in some way. So it's really important to be sensitive to that.
Right. Yeah, I know in my clinic, it's probably over six years ago, where we started seeing many more gender diverse patients, and it was challenging for our staff to get used to using gender neutral pronouns. And so it's understandable that if you're not used to using, say, they, them pronouns, that it does take time to get used to it. And we have to do our part to put in the effort and make sure that we do use correct pronouns, because I've seen firsthand how detrimental it can be, especially to our patients coming in when we misgender folks by using the wrong pronouns. Yes, and thanks again, Ali, for your presentation. It's really great work. And we have a lot of work to do to address the health needs of the community. So we'll talk a little bit more about that a little bit later as well. So I wanted to turn to Mary, and we're so grateful that you're here, Mary, to share your story and your family's story. So can you tell us more about your family and your lived experience?
Sure, absolutely. And thank you so much for having me here. This means a lot to me because we've had a very positive experience overall. I mean, certainly everything's a journey, right? Nothing is perfect. But if we can make the difference in one parent's life that is struggling with this, or one person's life who is going through this themselves, to understand that there's support out there, that will make this all worth it. So my family, my immediate family who lives in the house consists of my husband, and I have 3 children. They're 17, 15, and 11. And then we have 2 big crazy dogs as well. You can't leave Daisy and Tucker out of this. So that is the immediate family.
Tell us more about what was it like when your child first disclosed their gender identity?
Okay, so if you can remember, everyone was on COVID lockdown for a period of time, and things were a little crazy for us, especially working in healthcare and working in employee health. I was working a lot, and I can remember there was one night where she pulled me into her rooms 2 days before her 16th birthday, and she said, "I have to talk to you." And I sat down in her bed, and she handed me a letter, because she said she couldn't bring herself to tell me, so she wanted me to read. And in that letter, she said she was not my son, but was rather my daughter. And she initially was going to wait until she was 18 to come out. But she was struggling so much, and it was putting her in such a low place that she needed to just let me know. She needed to start to be her true self. She had said she felt like that since she was 12 years old, maybe even earlier, but became very certain that this was what was going on over the past year. It kind of hit me like a ton of bricks. I'm not going to lie. I didn't expect that right then and there. I am grateful for the way I reacted, though. As surprised as I was, I just hugged her and told her that I loved her no matter what. We would figure it out. What that meant at that point, I really had no idea, but that we were there for her. You love your children no matter what. That's what you're supposed to do as a parent, right? Our job is to create good little humans. So, well, the vision, what I thought that was going to be at one point, was going to be changing, it ended up being okay, but it wasn't easy in the beginning. I can remember leaving her room, saying goodnight to her, and going into my room and crying my eyes out, just because I was trying to process it. And again, your visions of the future change. I was trying to figure out how I was going to tell my husband. He was working, and all those different thoughts that go through your head. So it was interesting. Certainly doing a lot of the research and learning more. I already knew a fair amount from reading the medical literature. And quite honestly, as a parent especially, it's terrifying. I knew the suicide rates of the trans community, especially in people who are not supported. And I just didn't want my child to be a statistic. And that was really, the hardest part about it, was just trying to make sure that we kept our child safe and that she knew we loved her.
Thanks for sharing that, Mary. And I can appreciate that as a parent, you have a certain vision of who your child is and how they're going to grow old, and all these different expectations filled your mind, especially based on different cultural or societal views. And so when there's a shift there, it can be jarring and shocking. And there is that time to adjust and really process that information, which sounds like that was really needed. And I'm curious about how has the rest of the family responded, and what was the rest of the family's reactions?
Yeah, gosh, I wish everyone had the experience we had. I mean, of course, telling people wasn't easy in the beginning, but we are really, really blessed. I mean, starting with my husband, his first comment was, "Wow, she was dealing with this all by herself." And of course, he wasn't using those pronouns then, but like, how heartbreaking is that? And again, we were both just so grateful she told us. The letter we got was that this is who I really am versus the letter some other people find after their child is no longer with them. So that was so powerful for us that she trusted us enough to do that. Our siblings have been terrific. There's one sibling's spouse on my husband's side that was less than terrific and quite cruel, but thankfully not to our Cassie, and someone that we gladly just will not have in our lives. The hardest ones to tell were my parents, because they were 80 at the time. And that's not the way, their generation grew up. They're such loving people though. And people surprise you in such great ways. And the support that we got, of course, they were trying to wrap their heads around it like we all were. But they just said they love their grandchild no matter what, and they love us, and they are there for us. Our children were unbelievable, our other two, and I think kids of this generation are just so much more accepting, and they pretty much picked up, where we left off. Of course, there were questions, but I think they adapted the best. Friends, unbelievable. Her friends and our friends, her friends from Boy Scouts, she's still really tight with. Her best friend from growing up said, oh, cool, okay. And they're still tight as can be. Our friends were so supportive. It's just been unbelievable. But again, the one thing that strikes me, and actually it made it into one of Cassie's college essays, was how much the support of my parents in particular meant. And I'll probably get teary-eyed when I say it. So she was dreading the first Christmas coming around because we all had handmade stockings. And my mom had literally sewn every little bead, sewn our names on the stockings. And she was dreading the stockings coming out. But it was September, October before that Christmas. My mom asked if she could have the stockings so that she could change from the old name to Cassandra. And she has extremely arthritic hands. It hurts her like anything to use her hands. And she was having surgery on her spine. She was determined to get it done. And it meant more to Cassie than anything in the world when those stockings were hung up and she saw that. So we've been so blessed. But I guess it's coming from a house of unconditional love that we were able to respond in the way that we could with the same kind of love.
Right. Yeah, I love hearing about Cassie's grandparents and their response, because we do see these generational effects, and the newer generation is perhaps much more accepting and understanding of various diverse identities, especially sexual and gender diversity. Amazing how the grandparents have responded. So thinking about when Cassie was younger, any signs or signals, or is this something that you thought about previously?
So not being transgender was something I never, ever thought about. And it's always been so hard to say with certain things because I was never a particularly girly girl. I grew up with two boys, so you weren't allowed to whine, and you got lots of, punches in the thigh, and just had to tough it up. So in our family, we did a lot of things like camping, and we would go zip lining and hiking, and there wasn't a whole lot of shopping or, getting nails done and things like that. But she always just kind of marched to the beat of her own drum, I mean, I have pictures of her, putting all these bows and, my middle daughter's hair, and she would paint her nails once in a while. But it was things I never thought anything of, because there weren't things that were specifically, you're a boy, you have to do this, and you're a girl, you have to do that. I mean, every once in a while, we would joke, and I said it wouldn't surprise me if she told me that she was gay one day, and I wouldn't have been surprised. But and again, that would have been fine too. I didn't see this coming. Now now starting to look back on different things, I'm like, wow, okay, I can see it. I can see it in terms of even with different people she was more comfortable with. They were at a Catholic school, and while there were boys and girls in the school at the time, they really liked to keep the boys with the boys and the girls with the girls. And she always wanted to sit with the girls and couldn't understand why she had to hang out with the boys that were making, like the young boy jokes that they do. She wasn't comfortable with it. But I just thought that she's a really smart kid and she was mature. So, but I never really saw this coming. It wasn't something I thought about. The most was, again, in the medical literature that you'd read, or some of the terrible portrayals, negative portrayals that you would see on the news. And then, of course, the violence was just terrifying. So, the thought that potentially my kid could be a victim of that at some point just because of someone's hatred, that's just what's so terrible about this.
Right. Yeah, thanks for sharing that. In reflecting on gender identity and expression and thinking about my experience of like our society and culture here in the US, I think sometimes we can get really moved to extremes. And as it relates to gender, some of the things that you mentioned, Mary, in terms of being girly, and so it reminds me of, what does it mean to be male? What does it mean to identify as a man? And then now more gender neutral terms. And I think for a really long time, people were put into certain boxes. And if you were assigned female at birth and you're a girl, that means you must love pink and dresses and dolls and babies and all of this other stuff that is stereotypically associated with certain genders. So it's interesting to see how things have grown and changed and diversified over time. And I imagine for many parents out there, they may be interested in what the process was like after Cassie came out and disclosed her gender identity. Like, what steps did you take? What happened after she came out?
Okay, so the first thing actually was Adam, and I called you. I'm so grateful and in a good place working here to have such amazing colleagues and friends and resources to reach out to. And I wasn't sure where to begin. And so I called up Dr. Gonzalez, and I can remember saying, I only have one chance to get this right. I know how bad this can be if we don't respond the right way, where to start. And so Dr. Gonzalez helped us get hooked up with an amazing therapist, because as grateful as I am and still am that she will talk to my husband and I knew she needed more. She needed someone who really understood, someone that she could feel open with venting about, without worrying about hurting our feelings or upsetting us in any way, shape, or form. And so getting anybody in this situation, in any kind of situation in which there are questions, or you may be facing situations that could be difficult or challenging, it's definitely important to get that mental health aspect. And, throughout the process, we touched base with her therapist a couple of times when she was struggling in the beginning and wanted everything to happen yesterday. And some of it was, is it what she's going through, or is it that she's a typical teenager who wants everything done yesterday, that, immediate changes. So we were really, really happy about that. And the next thing was setting her up with, and again, everybody on this call is an amazing resource to me, Dr. Allison Eliscu. We switched pediatricians because Dr. Eliscu specializes. She knows what to look for. She knows what questions to ask, and is just so amazingly sensitive to the situation for the individuals and for the parents too. I mean, she was huge. I can still remember her coming out after she met with Cassie and telling me everything is going to be okay. I needed to hear that too, that we were doing the right thing, that this was the right way to go with experts that I trusted. We got her after a while. So this was part of her sophomore year, and it was at the end of her sophomore year that she came out to all of her friends. She was Cassandra at home, but she was Jason at school. And then once that summer came, she was Cassandra all the time. And so, throughout that summer that we did work on legal name change, because we were heading into SAT, ACT time, and FAFSA forms, and we were warned how difficult it would be along the way in terms of even financially if the name was illegally changed. Not to mention the fact that anytime someone accidentally called her by her old name or what, she refers to her dead name, it would just make her fall to pieces, and it was not worth that. We got hooked up with endocrinology, another Stony Brook doctor, Dr. Jennifer Osipov, who I'm so grateful for. She's wonderful, straightforward, educates you along the way, an expert in her field. And she even got us hooked up with Dr. Farquharson's TAG group. That was a group for transgender and nonconforming teens that Cassie agreed to be part of the fall of her junior year of school. And she had never wanted to be a part of the group, but that resource was tremendous for her because she got to speak to other individuals at different points in their journey. And it gave her some perspective too. She would frequently come out after and give me a hug because I guess she understood that we were trying to, any decisions we made, even though some of them may not have been as quick as she would like them to be, she realized they were all out of love and education, and realized she was, moving along a lot quicker than she thought she would. So there are a lot of steps, along the way, and it's really a lot more steps to go, but we're getting there. But we wouldn't have gotten there without the resources, which is why, again, it's important. I felt it was important that I'm on here, just because there are plenty of people that do not have the friends to phone that are in healthcare to help guide them along the way. And just know that we do at Stony Brook. There are tremendous resources here.
Yeah, I could appreciate, Mary, when you're talking about Cassie's, like that sense of urgency. And even from my own journey of coming out as gay, I remember like wanting to get that out there and have people accept me and embrace it. And it can take time. So for the individual, like for Cassie, this is something she's likely been thinking about, right, for years and years, and it's building up. And so just for parents out there and other individuals, there is that need and desire to want to be accepted and make these changes immediately because it's something that individuals has been living with for so long. You'll see the QR code on the screen. If you have any questions, please feel free to submit them to us and we'll work on getting those answered as soon as possible. Mary, just a couple more questions for you. Any concerns or challenges along this journey?
The concerns and challenges mostly are fears. Because again, we've been blessed to be surrounded by so many amazing family and friends and teachers at the school she attends that are so integral in this. And she's going to college. And it's my fear that one day somebody so filled with hate and a lack of understanding or ignorance is going to do something that is going to hurt my baby. And physically, emotionally, because the world is a scary, scary place. And I don't know, that's my biggest concern. And my concern is, for the people that don't have the support and resources, that it's so important that, as humans, we go out there and we spread kindness and we spread acceptance. So that people are able to get the help and support that they need to be who they are. Right. So it's terrifying. And actually, Allison, I didn't even get to tell you about this, but I was explaining to Cassie the experience we had after working with the med students the other day. And at the end of the day, she came to me and she said, "Thank you," and hugged me and said, "I wouldn't be alive if it wasn't for you." And I said, "Wait, what?" I mean, I knew she was down, but she said, had this support not been there, and it wasn't just my husband and I, it was my whole family. It was the teachers. It was the scout families. It was our friends. That's the reason. But she said she wouldn't be here. I mean, so to think that there's so many other individuals going through that with just a little extra support and acceptance, that could make all the difference in the world.
Right. Absolutely. Thank you again, Mary, for sharing your family's experience thus far. So you mentioned support and resources, and I think it's an opportune time to turn to that and talk about what we have available here at Stony Brook in our community and how we can best serve transgender and gender diverse individuals. So I'm going to turn it over to Dr. Farquharson to talk about some of the mental health resources and needs for this community.
Thank you, Adam. And Mary, thank you so much for being so open and vulnerable and honest with your journey. And please give Cassie hugs from us. It's important to highlight that here at Stony Brook, we have two main offerings for mental health support. One is our TAG group. It's titled Talking About Gender, and it's for transgender and gender nonconforming adolescents, ages 13 through 19. It's an 8-week group that we run out of our ambulatory clinic in psychiatry and behavioral health. We've found that group to be a really rewarding experience for the participants, as well as for us as our leaders. I work with Dr. Katie Neat, who's one of our child psychiatry fellows in that capacity, and we just enjoy working with this population. It's important to note that these young folks are looking for additional supports, and a lot of what we hear are some of the issues that Mary highlighted, and it's really nice to hear that the schools and institutions and the medical field is coming along and really advancing their support of this group. And we want to make sure that we continue to look at the voices that aren't heard. You know, the parents who won't allow their children to charge their insurance to go for care. And so we want to continue to look at healthcare provisions for that community. I think that's one of the things that our institutions should really start to take a look at. How do we get these resources out to people free of charge, meeting people where they are, because not everybody has such a warm and welcoming family as Mary has highlighted. Additionally, we understand that this is a process for the entire family. So we do additionally offer a parent group that's a free educational workshop for parents of children and adolescents that are going through this journey or just questioning their gender and unsure where they may be landing. Again, this resource, we understand it's different. People may have thought, okay, I have a vision for my child and that's going to be different. Getting used to these different pronouns is awkward for me. I think once young people, that's one of the things that I've taken away from group, when they see the adults in their lives, their doctors, their teachers, and their parents working through thinking and critically challenging their implicit biases. That in itself is a rewarding experience. So I would encourage parents to take advantage of these groups, take advantage of these opportunities, because it's only going to help. The more information that you have, figuring out ways to have these conversations with the elders in your family, what to do when that semi-distant uncle is not as supportive. What do we want to share with them? How do we want to elevate and empower our young people to have these conversations and protect them when they need to be protected, right? We do know that the world is not always a welcoming space, and we want to make sure that our children feel appreciated when they're at home with us.
Thanks so much, Will. And so, Dr. Eliscu, if you can share more about physical health care and how can we best take care of transgender and gender diverse individuals' physical health, including primary care, endocrinology ends up coming into the picture as well with hormone treatments and puberty blockers, and then also surgeries. So what are some services that we offer here?
Yeah, thank you. So I think it's really important that people feel really comfortable talking to their doctors, whether it's their primary care doctor or their mental health provider, or really any providers that are involved in their care, to be open and honest with them about who they are. As a provider, I feel like I can't really take care of a patient without knowing and understanding who they are, what their needs are, and how I can help connect them to resources and make sure that they're safe and give them accurate testing or vaccines that they may need that may be different without really knowing everything. So if you haven't, or someone hasn't talked to their primary care provider or any of their providers, it's really important that they should try to feel comfortable with it And if not, there are a list of providers. There are providers out there you could always change to. Like Mary said, their family felt like they needed someone who has dealt with this before, who sees many individuals who are gender diverse, and that's a piece of them, but it also can be an important part. And it's very important. It's a big thing, especially for adolescents and young adults, to feel like they're being heard. In addition to being heard by their teachers, by their friends, by their family, but that the medical community also hears them too, and understands what their identity is. So the link that was just posted up there on the page, that is a link of a list of providers at Stony Brook Medicine in multiple different departments that have expertise and specific expertise in helping to manage things like hormones, if someone is ready to take the next step to start gender affirming hormones or blockers, different surgeons that are able to help provide different services that an individual, gender diverse individual may need, primary care, gynecologists, mental health providers. There's a pretty comprehensive list. And one of the things that we're doing at Stony Brook Medicine is making sure that everybody in that office, if someone goes to one of these offices, is aware and respectful and understands the importance of using someone's appropriate pronoun and using somebody's name. And so that there's a good experience from the first person they meet in the office, the front desk person, all the way through to the last person at that visit. So that's been a priority and something we've really been working towards.
Great. Thanks, Allie. Yeah, definitely check out our website and the list of resources. There are great providers listed that specialize in LGBTQ care, and their office staff are also trained to treat people in a sensitive way. All of our office staff are undergoing similar cultural sensitivity training to make sure that we can best meet the needs of transgender, gender diverse individuals. There was a question that came through from Mary. Mary, what was it like making the decision to pursue puberty blockers or hormone therapy? You know, how was that for you as a parent to make that decision for and with your child?
So it definitely wasn't an easy one in the beginning. Again, I go to the literature, and of course, whenever you look for something, what do you find? Like worst case scenarios of things. But really, you know, looking through the literature and speaking to the endocrinologist, it was very clear that it was the way to go. We started low and we've gone slow. We started with the puberty blockers to kind of let those work. And then we had added the estrogen. And I will tell you, it has made such a world of difference. And really what was needed, and I guess where my husband and I had to truly understand what was going on while we were being supportive, it took a while for us to understand her. We'll never understand fully because we're not the ones going through it, but that this is what was needed. The gender affirming care has to happen in order for them to feel fully accepted, for her to feel fully accepted and fully herself, the person that she was meant to be, not the body she felt she was trapped in. And you can see a difference. She was already a beautiful kid, but certainly she's just beautiful now, inside and out. And we just continue to, you know, manage it along with getting blood draws, along with the endocrinologist. It's just, it was a great decision. It was a great decision.
Right. Yeah, well, you can see when you weigh those risks and benefits, as you were talking about before, and as we're very aware of, the suicide rates are alarming for this community. So allowing somebody to transition and providing affirming care is really the recommended course, and understandable that there are concerns that can go along with that. One last question, this is for Dr. Eliscu. How do you respond to parents who say that this is just a phase or a fad and they are not as accepting?
Yeah, that's a great question. And that comes up a lot in our discussion, especially when a young person first comes out and discloses. One thing that we frequently talk about is, though, even similar to Mary's experience, even though the discussion started at 16, frequently this is something that someone's been thinking about for a fairly long time, frequently years before they bring it up or before they disclose it to anyone. Sometimes they just disclose it to a friend or so. So even though it may seem like it's coming out of nowhere, it's frequently pretty well thought out. But one of the things I mentioned to families or parents is, even if you're concerned that it is a fad or a phase, we're talking about just trying to use a different name and use a different pronoun. And although that can be pretty difficult to make that transition, it's completely reversible. If someone decides that they at some point want to go by a different name or a different pronoun, it's really important that a child or an adolescent or young person feels that their parent is being supportive and making the effort. And if it does turn out to be a phase, all we've done really is make someone feel supported and feel loved, and help them grow and develop in a comfortable and safe place. So I think really kind of weighing the risks and the benefits when we're talking about things like names and pronouns, there really is no negative with it.
Right. Dr. Farquharson, how about you? Have you had this question come up? How do you respond to parents like?
Yeah, just piggybacking off of what Dr. Eliscu shared, I think the studies have shown that even if the adolescent changes their mind later in life, most often it's because of some of the external influences. So we find that almost 90% of people that decide to detransition do so because they had a hard time finding a job, or they weren't accepted in their school, or their medical professionals or mental health professionals, and of course their family was not accepting. And that level of stress really prompted them to want to detransition from their gender transition. So I think starting, exactly where Mary did, just thinking about it, having conversations, talking with family, exploring the options. It doesn't hurt to go to an endocrinologist and get some of the information. It doesn't hurt to meet with your primary and get information. It doesn't hurt to talk with a mental health professional about the societal pressures that person may be enduring, and having discussions with your child, with your family members about it, and trying to figure out, okay, what's going on. I think once the individual sees people trying and hearing them and supporting them, even that alone, again, you're not going to waste any time by supporting someone and just hearing their point of view.
Thanks so much, Dr. Farquharson. And thank you all for tuning in today for this really important discussion. Thank you to our panelists for their time and experiences and expertise. And again, Mary, thank you so much for sharing your story and your family's journey. We're going to share some more resources to close out this panel for today. So for more information about our Talking About Gender or TAG group and our free educational support group for parents of transgender and gender diverse kids, please check out the link below on the screen. We really welcome all to partake in these support groups. And then also for resources, education about transgender and gender diverse individuals and topics pertinent to healthcare for trans individuals, you can take a look at the resources that we have available on our website. And last and certainly not least, all of our great providers here at Stony Brook. So we have many providers that have specialty training in LGBTQ healthcare, and we're here to help meet your needs in our community. Last, certainly not least, we have our LGBTQ survey results. So Dr. Eliscu presented some of the main findings, and so we have a website dedicated to our survey results, and it breaks it all down with some great infographics too. So if you're interested to learn more about the Health Needs Assessment Survey, feel free to check out this site below. Thank you all again. Have a great weekend. And this Sunday, if you can, please pause for a couple of minutes and remember all those transgender and gender diverse individuals who have lost their lives to violence. Thank you again.